joints. It's not just about hips and knees and shoulders. There's many types of joints, and some don't even seem like joints. We classify joints according to their structure. They could be fibrous, cartilaginous, or synovial. Most of this lecture is about synovial, and here is a nice example of a synovial joint of the knee. Medial collateral, lateral collateral. These ligaments are going to prevent some types of movements that would be injurious to the knee. We also have an anterior and a posterior, here it is, cruciate. And those are also going to limit some movements. There's menisci and many other parts. Look at that. Isn't that wonderful how that happens? Well, let's move to our first type of joint, which will be the fibrous. They don't even seem like joints, like the sutures in the skull. In fact, later, sutures become synostosis, which means they're bony. They're no longer cartilaginous. We need them full of cartilage when a child is exiting the mother's body through the birth canal. We want those plates to be able to shift just slightly. The posterior tibiofibular ligament, upper right, also needs to have a little mobility, but not much. Just enough to allow some pivoting there. Gomphosis of the teeth, the periodontal ligaments, they're going to allow some movement, but very little unless you get periodontal disease. And that is why we're very gentle when we brush. We don't want to traumatize those fragile ligaments. Soft bristles, slow circular movements. Interosseous membranes between some bones that are going to define the range of motion. So ulna, radius, good example. Cartilaginous, the second type. We have synchondrosis. Look at the middle of that word, chondro. So it's a cartilaginous joint. We think of the epiphyseal growth plates in someone who's still developing. Now, of course, that's going to ossify and become bony later in life. We think of symphyses like the pubic symphysis here of fibrocartilage that is very rigid unless you're pregnant, and then it softens a bit. We also have the intervertebral discs of the vertebral column, which are dense. These are joints, and the spine does flex. The body of the sternum flexes slightly, so slightly with the manubrium to allow some force to be applied to the chest without bones shattering and breaking. Synovial is the third type, and the remainder of the lecture is going to focus on these. We think of range of motion. For most synovials do have a large range of motion, although maybe not the ankles and the wrists. But the articular capsule, let's take a look at the articular capsule. It has this outer fibrous membrane. Here, if you look at the right, outer fibrous membrane, it's like ligamentum. And then there's an inner membrane that's going to produce fluids, and we'll talk about that shortly. We don't have double jointed individuals. I know maybe they can stretch their fingers to touch the back of their wrist, but it just means they have a thick cartilage and a lot of space in that articular capsule. But sometimes a little bit of instability and dislocations occur there. On to synovial fluid. I like synovial fluid. It's like the consistency of motor oil, except it's clear or pale yellow. It contains hyaluronic acid that lubricates the joint, absorbs shock, and it's going to reduce friction and wear. Because can you imagine these joints, how many steps you take in a day? And if that articular cartilage was directly in contact, we'd have problems. But we have this fluid, this pressure in there. Cartilage is avascular, so it has no blood supply of its own. It keeps from starving by feeding from the synovial fluid, oxygen, nutrients, and even phagocytes, these tiny cells that are going to remodel the cartilage when there's a little tear. Now, too much remodeling, and we have arthritis. Joints are built to move, and that's why we attach patients to movement devices after surgery, because we want to stimulate the flow of synovial fluid. Why do joints pop and crack? It could be because the blood vessels surrounding the joint will diffuse gases like oxygen and carbon dioxide into the joint, and then when the pressure changes, those bubbles pop. Or maybe the cartilage just sticks together because they're slick and it's a very viscous, sticky area, and then when we move the joint apart a little bit, there's a sucking sound. No one knows for sure why our joints pop. Accessory ligaments, we looked at these in that initial video. We have extracapsular ligaments that are outside the synovial, such as the fibular and tibial collateral ligaments. Remember those? Where are they? Here they are. There's a medial and there's a lateral. The intercapsular are things such as the cruciate, anterior, posterior. There are articular discs made of fibrocartilage, and they can divide the compartment, such as the TMJ, which we don't have a picture of. But we do have the meniscus. Meniscus is singular. It's like a gasket here. It's going to absorb some shock and help distribute weight, but it's not a complete gasket. So it creates partial cavities. The labrum, think of a lip or a rim, another kind of gasket really. So we have an excess area here, and well, it's extra area for deepening the socket and increasing the area of contact between two joints. Now it can be torn, such as when the bone you have dislocation. That's pretty severe. For most people over time, by the time they're in their 70s, there's a lot of wear here, and people often don't even complain about it. It shows up in their x-rays or in the imaging, and it's the serious ones is when the bicep tendon, which attaches to that upper socket, it's going to bring the labrum and tear it in what's called a superior labrum anterior posterior tear, or just a slap. And that's where you get that catching pain that some of you probably have had. Everything's fine, and then a certain posture of the arm. Oh! Nerves may signal pain, but also tell us a little bit about where the position of our leg is. Now, I mentioned that cartilage is avascular, has no blood supply of its own, but there's a branching network of peripheral blood vessels that are going to penetrate the articular capsule and provide oxygen and nutrients and phagocytes I mentioned, and also remove carbon dioxide and waste. So this beautiful process occurs unless we have avascular necrosis, which ended the career of Bo Jackson. This was many years ago. Fullback and a baseball star all at the same time. But he took a hit at the hip, and the blood vessels were torn. Avascular means without vessels, and necrosis means to die. So without blood vessels, it looks like osteoporosis in a sense. The tissues die, and the head of his femur just crumbled due to it wasn't really a dislocation; it was an impact. Bursae, we don't hear about these much, but take a look at the lower right, and you'll see an example of a bursae. It's outside of the capsule, so it's really not part of the synovial joint, but it functions like a joint because it has the outer fibrous membrane, it has the inner synovial lining, which is going to secrete these fluids that are very much like synovial. If you get bursitis, sometimes we don't know what causes it. It's sometimes irritation, traumatic impact, pressure, infections, syphilis, tuberculosis, rheumatoid, so and a lot of unknowns. Etiology unknown. We just have to say we don't know what causes it. Usually it's temporary. A tendon sheath, if you look at the upper right, thank goodness for these, like the bicep brachii tendon, has a sheath. Otherwise, if the tendon kept rubbing against the tubercle and some of those connective tissues, it would just fray and wear out. But we have this wonderful lubricated sheath. Synovial sprain is caused by forceful wrenching and twisting. And there's different grades. We give them grades. Let's look at these. There's if there's stretching with microscopic tears, then we have grade 1. And usually you have pretty good function and a little bit of pain, a little bit of swelling, and not much discoloration. Grade 2, now we start to get some partial tears and some pain, edema, which is swelling, and function and difficulty bearing weight. And then finally, a complete rupture, which is grade 3. I'll tell you, sometimes in the case of the talofibular up here, lateral side, or the calcaneal fibular, they will pull a chunk of bone out before they'll tear. That's how, that's the tensile strength of these guys. Amazing. But when they do tear, then we get some intense pain and swelling and inability to bear weight. All right, those are the different types of joints. Make sure as you walk away today, appreciate that synovial, smooth, graceful fluid in your body as you stroll away.